Hi, everyone, and welcome to the fourth day of UN Behavioral Science Week. Today, we have an exciting session on expanding behavioral science methods for policy and practice. Before we get into it, let's go through some. Yeah, so Behavioral Science Week is a 5-day event with 15 different seminars involving 46 different entities and 60 speakers. We run it every year. This year it's been extremely exciting with a lot of really interesting sessions, focusing a lot on the technical components of behavioral science. So we've covered everything: AI, digitalization, data science, and of course today's deep dive into methods. We're on the fourth day now, but if you've missed any of the previous session, I would highly recommend going onto the UN Innovation Network YouTube page and catching up on some of these sessions. They've been excellent. So UN Behavioral Science Week is brought to you by the UN Behavioral Science Group, which connects UN entities and supports the adoption of behavioral science. We have 7,000 members across the world, 70 plus UN entities across 150 countries. Anyone can be a member. Simply sign up and you'll be updated on all the different initiatives and webinars that are run throughout the year. So go over to the website and read all the great publications that have been out and all the different sessions that we run throughout the year. So just to situate all of this, so why behavioral science? So behavioral science is one of the 5 quintets of change as part of the UN 2.0 initiative, trying to push the UN into the future. So for our session, please submit as many questions as you want. Use the Q&A button in Zoom. And yeah, please share all your questions and we'll get to those at the end after our speakers have presented their pieces. So who are our speakers today? So we have Mario Herbes from the ILO, Danielle Hernandez from World Bank, Fern Terrace-Prestott from UNAIDS, and Simon Williams from WHO. So today, what we're going to be talking about is methods, which is a really exciting area because behavioral science is multidisciplinary in and of itself, which means that it affords itself access to all these great different types of tools to really understand behavior, understand and measure behavior and behavior change. You know, we've always most of you have heard about the use of RCTs for evaluating programs or just talking about standard surveys to understand behaviors, but that's just scratching the surface of what behavioral science uses to really understand the behavioral insights across the thing. And so our speakers will be exploring and will be sharing some of their experience of different methodologies that they've used to try and understand these behaviors. So without further ado, I'd like to let me just stop sharing that. Okay, so I'd like to bring on our first speaker, which is Simon Williams from WHO, who will be talking about message framing experiments. So if you don't mind turning your camera on, Simon. And yeah, cool. And if you can go full screen.
Yes, thanks, Cash, very much. It does say video disabled. I don't know if that's something.
Okay. Okay.
But I will start. As long as you can hear me, I guess that is the most important.
Yes, we can, and we can see your slides. Thank you so much.
Perfect. Thanks ever so much. So, hi everyone. My name is Simon Williams from the WHO. Today I want to talk to you about actually our project led by the World Health Organization's Behavioral Insights Unit, which uses large randomized control trials to evaluate whether using message framing can enhance the effectiveness of risk communication on social media. I mean, generally speaking, communications teams tend not to systematically and intentionally design social media messaging using behavioral science theory and constructs. And so ultimately, our objective, I guess, of this work is to provide evidence-based insights to communication officers on how to optimize messaging campaigns on topics, as you can see there, like everything from measles through salt and salt control through to vaping, using behavioral science and especially how to communicate risk through that lens, We know from the literature on health promotion that behavioral science theories and constructs can enhance effectiveness of interventions, but we do need more evidence to test whether behavioral science theories and constructs can enhance interventions in real-world settings, including social media campaigns. So we set out then to test whether two sets of paired constructs, that is loss and gain framing and gist and verbatim representations, could enhance the effectiveness of social media messaging across three different health topics, that is measles, SALT control, and vaping. The key outcome measures we used were risk perception, perceived importance, and behavioural intentions. Literature has demonstrated, for example, how the ways in which messages are framed, that is in terms of a loss or a gain, can have differential impacts on people's risk perceptions and behavioural intentions. Here, for example, on the right, you can see an example from our WHO vaping campaign, which uses two versions of the same message, one which utilises a gain frame, that is emphasising the health benefits of not vaping on the right, and one which uses a loss frame, that is emphasising the health harms of engaging in vaping. Similarly, we know from research that gist messaging, that is messaging which conveys the essential bottom line meaning, tends to be more effective at communicating risk than verbatim messages which tend to focus on specific details and facts. Here's an example from our measles campaign where we tested both gist and verbatim versions of a campaign designed to communicate the risks of measles and the benefits of measles vaccination. And overall, these framings were selected through an extensive literature review, through consultation with a multidisciplinary team of experts, and the messages themselves were developed collaboratively by a team of behavioural scientists, health topic experts, and communications officers to ensure both the accuracy of the information, most importantly, and also construct validity of the BI framings. Overall, we've conducted 6 brand lift studies in global campaigns on Facebook and Instagram platforms in approximately 183 countries, although the specific number of countries did depend on the particular campaign. Overall, the total reach of these campaigns was approximately 888 million people, so a very large reach, averaging out at about 148 million reached per campaign. Brand lift studies then, as you can see on the right, they entail a group of social media users from a given target population, seeing a message in the form of a social media ad, and a control group which sees no message. Both groups are randomly assigned from a defined population of social media users, and we can use the platform's own targeting criteria to define the key target population. For example, in our case here, young adults aged 18 to 35 for vaping, and parents with young children aged 0 to 5 for measles vaccination. Thereafter, a random sample of users from both groups are sent survey questions directly through the platform, and we can then analyse responses to determine the difference in the proportion of those in the test group, the messaging group, who report higher concern or higher intentions compared to control group. And this effect, or lift as it's referred to in this context, can be extrapolated from the survey sample to the total population exposed to the ads. Overall, across all brand lifts, we found that there were 43 million people who showed higher concern or increases in perceived importance of a topic or intentions towards engaging in a behaviour in those who saw the messages compared to control. We also found some evidence of ways in which particular framings enhance the impacts of some messages. For example, contrary to our hypothesis in the literature, verbatim messages were actually more effective in increasing risk perceptions and intentions among parents of young children. We did some in-depth follow-up survey research to explore this more and found that this may be partly due to the fact that actually numbers and the use of these type of statistics conferred a kind of a scientific credibility. It made the messages feel more scientific. We also found, for example, that lost messages were more effective in increasing intentions to avoid vaping in young adults. And again, some follow-up in-depth research we did on this suggested that actually conveying the severity of vaping was done more effectively by the lost messages. Overall, then, we think this work suggests that communication teams can improve the behaviour change aspects of their social media by using behavioural science constructs and theories to design and evaluate messaging. Brand lift studies, of course, have limitations, like all methods. For example, we were only able to use 3 to 4 brief poll questions. We weren't able to go into depth on sociodemographics beyond age and gender of users and responses. However, a key strength is that they can provide causal inferences about the causal effects of messaging in the real-world settings on social media as field experiments, and they go beyond traditional social media metrics or add to social media metrics like engagement data. Ultimately, we would recommend that organizations can use this approach, amongst others, to test different constructs themselves in crafting their own messages on their own topics and indeed for their own specific populations and audiences. Thanks very much.
Thank you so much, Simon. That was really interesting. Maybe if you could answer one quick question, is essentially, and we'll try and address this further on, but did you see any differences between countries?
So one of the limitations, I suppose, of the brand lifts, at least as we designed them, is that you cannot readily break down that poll data by countries. You can interpret data. However, colleagues in the WHO and maybe across different organizations can set these up so you could look regionally, for example, and then look for differences. So you could kind of qualitatively compare. I think that is important.
So you set it as a global campaign, and so, okay.
A global campaign with also other limitations and caveats around the messages were in English only. So again, there are other ways you could expand these.
Fascinating, but this is early days and so much more to explore. Fascinating. That's great. Thank you so much.
Thank you.
Cool.
Thanks.
So now, moving on to Fern. Fern will be talking to us, talking us through an example on discrete choice experiments. Go ahead, Fern. Oh, you're on mute. Sorry.
Good. Thanks, Simon, for setting the pace, very peaceful pace, which I will try to emulate. And also setting the scene, because I'm going to build on what Simon talked about, very large-scale trials, and try to share one step that Simon could have introduced in between and some of the advantages and disadvantages of that, as well as address the question, Kash, that you raised around heterogeneity, and introduce a method that may be able to help understand that heterogeneity that you were asking about. So the title of my presentation is Using Discrete Choice Experiments to Segment Markets and Design User-Centered, Complex, Behavioral Intervention Trials. And this was a piece of work, and I'm going to use an example from a study that was joined between UNAIDS and INSP in Mexico. So we've gotten pretty good in behavioral science at introducing formative research for complex interventions, behavioral interventions, and we use them to understand local conditions and shape the content and design. But what do we do with all this qualitative research? Once we've generated loads of barriers and facilitators to either trial participation or service uptake. How do we prioritize them? How do we understand the heterogeneity that is coming around? When you do have complex interventions like this trial that Simon has just done, very large, how do you know that you're getting the intervention right? The best one that will maximize your opportunity to show that your intervention works and that you're not going to throw it away because something tweaked around the edges went wrong. And I'm doing this coming from the experience of working with new HIV prevention technologies that weren't a success, not because the product didn't work, but because the use was in some groups was higher than others, and many people joined who may not actually have been our ultimate target group. So is there a role for discrete choice experiments, and is it worth the extra time? I'm going to talk about intervening at the development phase of this process of intervention and trials. So this is in the context, so I'm going to show you with you an example of work that we've been doing along the migrant corridor. There are nearly 1 million displaced people between Honduras, Guatemala, and El Salvador alone. Migrants face heightened risk, including infectious diseases and HIV, as many of you out there probably are well aware. But uptake of services along the route is low, in particular around HIV services, many of the migrants consider that they want to postpone anything that's not absolutely urgent until they get somewhere. So from a UNAIDS perspective and from an infectious disease perspective, how do we support and encourage uptake of HIV prevention in this very vulnerable time? Can we apply behavioral insights? So you're all familiar with the EASE framework probably. So how do we make it easy and attractive? How do we operationalize this? So we did a discrete choice experiment among 296 migrants in 4 countries in 2023, and we're about to submit the paper now. So what is a discrete choice experiment? A discrete choice experiment is a way of eliciting preferences that we can quantitatively measure. So what happens is you present a scenario, a framing, as Simon pointed out, which is, in this case, would you prefer service A with injectable PrEP assisted by a doctor with STI testing and treatment in a shelter, or service B, or would you not want to do either of these? And by presenting repeated scenarios, you can quantitatively analyze these choices, like when you go to a supermarket or when you're choosing between health services yourself, and it generates quantitative measures of what we call utility, preference for each of these different levels. It is, of course, preceded still by the qualitative research that we were talking about. So what do you get out of the discrete choice experiment? You can get out relative strength of preferences. So here, for example, you can see that for medical care, there was the preference for medical care has 1/3 the strength of the preference for STI testing and treatment. So a big difference. So not just they like it better than that, but 3 times as much. And in this group of people who actually had a high preference not to seek any services, you see the utility -185, you can almost compensate them by providing the services through the pharmacy. The second thing that you can do is look at heterogeneity. So depending on the type of statistical model you use, so in a latent class model, you can cluster the preferences into different groups or market segments. And so then you understand that class 2 prefers injectable PrEP and PEP and really dislikes daily PrEP, whereas class 1 likes your daily PrEP. So that really helps us to understand if we need to put together 2 different models of care to reach these different populations, how do we do that? Then what we can do based on that is we can understand how large and how important these different classes are. If we only can do one model, do we want to reach the largest group, class 1, 61%? Or do we want to reach the most vulnerable group? For example, class 3, we actually had 3 groups here, that has high experience of violence, discrimination, lower education, more likely to be women, but they're only 6% of the women. So this helps us to really understand preferences across classes. And last but not least, it helps us to configure services for the different populations. So the green bars would be for each of these categories, the preferred services. So class 1, daily PrEP from a doctor with medical care in a shelter. Class 2 has the green bars. You can also predict uptake, so you can use this to predict uptake into the future, modeling differences and variations by if I can't do STI testing, but I can have medical care, what is the impact on uptake across different groups? And if you include willingness to pay, you can also estimate social values for it. Yeah. So to draw to an end, this is a growing area of research. You can see huge increases over time, especially among behavioral scientists and trialists and beyond. It does take extra time in that formative phase, and it assumes that people can predict what they will actually do, and that it's an individual choice, which in our case in HIV, sex is not always an individual choice, how you do your prevention, and it assumes rational decision-making. The advantages is that it provides a quantitative measure of different target group preferences so that we can tailor services. You can also simulate the outcome of your trial before you actually go to trial and see what the chances are of actually showing a significant difference in uptake, and gives concrete recommendations where you can, how your intervention is going to get the highest uptake. Now, I did say it assumes rational decision making. You're all going, nobody's rational, but actually there's increasing evidence of predictive validity. And I just show a reference for those of you interested. Thank you very much. If you're curious and want to know more, there's my email address, and thanks for listening.
Thank you so much, Fern. Quick question for you. Oh, sorry, wait, now there's multiple questions coming in. Sorry, give me 2 seconds.
Can I acknowledge my co-authors
Yes, please
in
go ahead.
INSP and Monash University, done before his PhD, Diego Carcero, Sergio Bautista, Jason Ong. Thank you for working together on this.
Thanks. I guess I'll go with this one, which is, what is your experience communicating these results to policymakers? Especially since, it's not, DCEs aren't as commonplace as a standard A/B test as we saw. And obviously there is a bit of translation that needs to be made from the actual output to policy recommendations. So any hot tips?
That is a fantastic question, and really goes to show that this method originates in academia and is used in social marketing, where it's to develop their own interventions. But now we are working more and more on what types of visualization helps policymakers really understand the results. I could show you the statistical outcomes, and I've chosen to show you bar charts to bring it a bit more to life. But you're absolutely right that these are not it's not that simple. Well, you can simplify it saying they like this better than that. But the nuance is really the heterogeneity and providing those profiles of people. But it is a really good point that we're getting better at it over time. In the past over 25 years, 20 years that I've been doing this, I think I've improved, but still a challenge, you're right.
Excellent. Thank you so much. So yeah, we've gone from like, sorry?
The skills of doing the statistical analysis is also not as, it takes a little bit more.
Hierarchical modeling is not an easy thing to explain, for sure. Definitely. And that's why this session's so interesting, because we've just gone from like large scale global measure of just like a single choice to digging into deeper with a smaller set of people making multiple choice to extract a deeper concentration and to understand the heterogeneity. Thank you so much for that, Fern. So moving on, let's explore some other methods of measuring behaviors. The next two cases are exploring different, quite unique mixed methods approaches. So I invite Mario to come on. Mario is going to talk us through some immersive meshes of behaviors. Go ahead.
Right. You see my screen all right?
Yes, perfect.
Perfect. Thank you, Cash, and thank you also to the UN Behavioral Science group for the invitation to this panels. I'm very excited. I think the main advancement in comparison to the previous speakers of this talk is that our goal in this research was to get closer to actual behavior without having to run a randomized field experiment, which we all know is extremely complicated to set up in many contexts. So I will present this line of research that we conducted at the ILO, where we used a range of behavioral science methods to promote the fair recruitment of domestic workers in Hong Kong. In Hong Kong, where despite existing regulations, domestic workers' rights are being violated. And one reason for this is that employers, which can be people just like you and me, who simply need someone to help them out in their home, they continue to hire employment agencies that commit illegal practices. Employment agencies are the intermediary between domestic workers that often come or are recruited from abroad and the employers that are in Hong Kong. And the illegal practices from which they suffer is that they're taken away their passports or charge excessively high fees, and that basically puts them at the risk of forced labor. So whether an employer chooses a legally or illegally practicing employment agency is extremely crucial. But there's still very scarce literature and very little understanding of how employers actually take these decisions. So the goal of this research project was to dig into this, to learn about how employers take these decisions, and then to be able, based on these insights, to encourage their due diligence in the process of selecting an employment agency. And so in this research, we conducted this research in 3 stages. In the first stage, since there was very little literature that we could draw on, we conducted semi-structured interviews with a handful of employers, which then led into the design of message frames that were designed to encourage, or that we chose to encourage employers to do their due diligence when looking for an agency. So this range of message frames, they try to make employers be more motivated to get better informed about the employment agency they hire, and thereby being able to avoid employment agencies that kind of look fishy, or that are kind of like pulling up a red flag, to recognize that better. And among these message frames, we found some that worked much better in having this effect. So we tested these message frames in a randomized online experiment, and message frames, for example, related to the social norm of employers in Hong Kong, paying more attention to how they make these kind of decisions, but also the goal of avoiding employment agencies that might cheat them, right? Something very, very emotional. They don't want to be cheated, employers. So that really incentivized people to get better informed. And so we identified like 3 or 4 message frames that were really more effective than a neutral comparison frame. And these message frames were then integrated in the last stage of this research into the design of an immersive online game, which you can check out. We will also share the link in the chat. The hiring challenge, where people or users are put into the position of a person living in Hong Kong, having to go through the process of recruiting a domestic worker and all the challenges that they might face throughout this process. And so it's the behavioral effects of this immersive online game that I want to present you a little bit more in detail. So basically, and that's, I think, the very important part, is that we looked into the short-term behavioral impact and the long-term behavioral impact. So basically what we did is that one group of participants, they completed their immersive online game and another group didn't. And then we asked participants whether they adhered or they intended to adhere to a range of fair recruitment practices that you can see here on the left. So to check the agency of a license, to check the online reviews for an employment agency, or to simply discuss their choice with their peers. And what we could observe in the results was that very consistently across almost all of these actions, participating in the online immersive game increased intentions to adhere to the fair recruitment practices among employers. So this was already a nice validation of this awareness raising tool of the hiring challenge. But then we wanted to go one step further, okay? Because we know that intentions do not always translate into actions. So what we did is we had a follow-up experiment, or we recontacted participants who we had pre-selected based on their current searching of an employment agency. And within these 6 months, we expected them to having completed this process. And so we got back to them, and then we asked them, so which of these actions did you actually show the last time that you interacted with an employment agency or a worker? And so although we had quite some dropouts and that made it difficult to find significant effects, we found that even after these 6 months, there was a significant increase for the checking of the agency license among the people that had completed the immersive online experience. And we also found a marginal effect on the checking of online reviews. So to wrap up, in this project, we demonstrated the value of the mixed methods behavioral approach to inform the design of this awareness raising tool at the ILO. We also demonstrated how a longitudinal design can increase the validity of the behavioral outcome, where we can be more confident that this is actually closer to the behavior that we would actually want to measure. But then we also identified challenges, right? So scaling this up is quite complicated because we worked with panelists, and how do we get people to participate in this immersive online game? Just out of their own spite, or this tool, to integrate this tool into existing procedures. And then this longitudinal design is always kind of tricky also because you quickly run into power issues, right? Because people do not respond even if you send multiple reminders to your follow-up survey. And with that, stay tuned. We are writing up all of the results of this line of research. The promising practices ILO brief is currently under production. And if you have questions, feel free to reach out. Thanks a lot.
Thank you so much, Mario. That was excellent. We have one question for you, which is, what lessons did you learn from the interviews? What suggestions do you have for people working in new areas like this without literature? I guess if I'm to rephrase that a little bit, is what was the process from having those qualitative interviews? How did you then translate that into developing something more elaborate?
Yeah. I think these interviews, they basically identified one thing, is one general topic was that people don't put much effort into these choices. Okay, so it's quite intuitive decision making, which is exactly where we then can try to design message frames to kind of guide their decision making. And then obviously they kind of raised concerns with regard to not wanting to be cheated, and this kind of stuff. And also that they really relied a lot on actually peer influence, which then also made us look into the social norm intervention.
Cool, thank you. One question from me. Did you collect any data on how people navigated through the simulation? Which also for the audience, definitely check out. It's really cool. But yeah, did you collect any web-based interaction data along that?
No, we didn't. I would love to do that. The hiring challenge it takes 15 minutes, and it's quite a thing. And it touches obviously at different processes. It touches upon different things. You see also some witnesses that speak in videos about their experience and so on. I mean, it would be even just tracking how people navigate with their mouse or anything that would be great to do this research to get a little bit more of a idea also on what really their increase in intentions. Yeah.
So we look forward to that next year then. To present. Excellent. Thank you so much, Mario.
Thank you.
Excellent. Now we move on to World Bank with Daniel, who's going to be talking about some of the challenges of measuring some very difficult concepts. Go ahead, Matt.
Thank you so much, Kash. Good morning, good afternoon, and thank you so much for this opportunity to share how we combine task-based measures and self-reports to measure human potential at scale. I'm Daniel from the Mind, Behavioral and Development Unit at the World Bank. Our team specializes in applying behavioral science to development challenges across low and middle-income countries. We work to integrate behavioral insights into policy design and build capacity. Today, I will walk you through our framework for turning behavioral diagnostics into scalable tools with a focus on our skill profiling tool, a hybrid system integrating self-assessments and tasks. Like many behavioral units, our work begins with mixed methods, combining surveys, observational tasks, and qualitative research to uncover the why behind behaviors. This foundational phase ensures interventions are rooted not in assumption, but in real-world context. Second, we employ rigorous experiment methods to test hypotheses and refine interventions. This bridges diagnosis to action, ensuring solutions are both behavioral informed and empirically validated. Third, scaling proven solutions amplifies the impact. By prioritizing adaptability, we ensure that tools retain effectiveness across diverse cultural, economic, and operational settings critical for system change. And finally, disseminating evidence and tools closes the loop. Through toolkits and capacity building programs and open access resources, we democratize knowledge, empowering stakeholders to replicate success and foster a global ecosystem of evidence-based practice. Building on this framework, we developed a public good skills profiling tool. The purpose of this tool was to help youth understand their job and entrepreneurial relevant skills and empower them to apply for jobs, pursue upskilling, or launch ventures. Moreover, the tool was built to reach difficult to access populations, including low literacy youth, often excluded by traditional assessment. By measuring 21st century skills like persistence, the tool merged insights from self-reports with performance data from tasks. The approach ensures scalable, reliable measurement of competencies that are typically hard to quantify. In practice, the tool diagnoses skills gaps through intuitive tasks and scales the diverse tailored feedback. To ensure that our skills profiling tool delivers accurate and actionable insights, we anchored it into two foundational principles. First, validity, that is measuring what we intend to measure, and reliability, that is ensuring consistency. Starting with validity, we first ensure content validity by collaborating with psychologists and rigorously aligning our self-report questions and tasks with established literature. This guarantees that they truly reflect the skills we aim to assess. Next, construct validity was confirmed through statistical methods like factor analysis, which verified that self-reports capture distinct traits. While for tasks, we validate them against real-world behaviors to ensure they measure what's relevant in a specific context. Finally, criterion validity ties our tool to tangible outcomes. We found a strong correlation between users' self-assessments, task performance, and real job markers like job history, job search behavior, and wages. This proves that our tool doesn't just describe skills, but predicts success. Turning to reliability, we find that, sorry, just a second. We find that the test retest ensures that the responses are consistent across users and time. For self-reports, we use statistical methods like Cronbach's alpha just to ensure that our factors may preserve in the different contexts. Designing tasks that ensures a clean measurement of the intended attribute and minimizing familiarity that affects these results. For the tasks, it's important to try to identify and control for irrelevant factors that may influence task performance, ensuring a clean measurement of the intended attribute, designing tasks to minimize familiarity effects, and ensure that repeated administrations do not undermine validity when relevant. Training evaluators to score performance consistently are also important for in-person settings. Together, these methods ensure that tools is valid and reliable for measuring at scale. Achieving this rigor requires iterative refinement. For instance, in validating the skills profiling tool, we improved translations, dropped poorly performing items, and adjusted task difficulty based on real-world testing and pilots. What we have learned is that both self-reports and tasks have unique strengths and inherent trade-offs. Self-reports, for instance, are cost-effective and efficient, allowing us to gather data quickly at scale. They are particularly powerful for tapping into constructs rooted in self-concept, and when designed thoughtfully, they achieve strong reliability and predict real-world outcomes. But self-reports are imperfect. They rely heavily on literacy and comprehensions, which can exclude marginalized populations. They are also vulnerable to biases. Respondents might overclaim skills they lack, conform to social expectations, or misinterpret questions entirely. Self-report tells us what people believe about themselves, but not always the full truth. And this is where the tasks truly shine, because by observing actual behavior like persistence, we gain objective, actionable insights that transcend language barriers. They rely on intuitive actions, visual cues, and scenario-based interactions, eliminating the need for complex instructions or written responses. This design ensures equitable access, allowing individuals with limited literacy to demonstrate their skills authentically. Tasks not only bypass biases, but also standardized measurement, removing subject interpretations of gradient scales. Yet, tasks comes with their own challenges. While they reveal what someone does, they often leave us guessing why. Inferring motivations require careful design. Tasks can also be contaminated by external factors like fatigue or prior exposure to similar activities. And in repeated use, familiarity can distort results. So what are our takeaways? Neither method is superior. Instead, there's synergy of self-reports capturing internal states and tasks revealing external behaviors create a holistic view of human skills and behavior. By combining both tools, like in the skills profiling tool, we mitigate individual weakness and amplify their strengths. Thank you so much.
Thank you so much, Daniel. That was excellent. A great breakdown of the trade-offs between the two different approaches, which is always a tricky decision whenever we're trying to design evaluations or trying to design interventions. So in your case, your final pitch was basically you have to do both. But I guess in some situations that you might not be able to afford that for various reasons. Are there specific domains where one would be better than the other, or specific contexts? Like, if you had to choose, like, are there any heuristics that you might adopt to try and choose between the two?
That's a great question. I think more than the context, because you can apply both of them in different concepts, different settings. Always really important to have a pilot to understand how it is working. It's more that based on the literature, there are some specific facets, there are some specific skills that are easier and more validated to be implemented in specific settings. So for example, if we are talking about mindsets, if we are talking about executive functions, that's where tasks makes more sense. If we are talking about personality traits, if we are talking about social-emotional skills, that's where the self-reported skills had a lot of evidence that have worked in the past. And probably, for example, for a context that you are interested in, you may see already some evidence of how self-reported assessments work for example, for social-emotional skills. So depending on previous experience that you might find in the specific context and depending on the nature of what you want to measure, for example, social-emotional skills versus executive functions, you may find one or the other being more relevant and easier to apply to the specific context.
Excellent. Thank you so much for that. I now invite all the speakers to come back on camera. Sorry, Daniel. Because now we'll move on to some general questions. I guess so we have a bunch of questions that are a bit more specific to each speaker, but I think before we go into that, I did have one which was kind of being reiterated through many of the others, which is the trade-off of generalizability and scalability in choosing your methods. So we started off with Simon, where he started off, it's a global level method where he's getting a lot of insights, and you could argue that it's more general, assuming there's representation. You could argue that there's more generalizability because he's measuring on a global scale. However, in some of the other examples, we've dug deep into a specific country, a specific context, where then those findings might not be generalizable, and then like those specific insights might not be scalable, generalized to other contexts, but then also the method becomes more costly, as the case with Daniel trying to do both self-report and task measures, where then the scalability of that becomes tricky. So open to everybody, like how do you then approach this? Yeah, do you trade off the measuring efficacy versus the cost on, and yeah, so anybody. Fern? Oh, Fern, and then Simon, please.
I think it depends also what your objective is. Is your objective to get a good intervention out there, or is it the objective to be able to measure your impact? And we'd like to be able to do both. But sometimes some of these adaptations with our new technologies can be done a priori, right? With technologies, we can help people identify their preferences and make better treatment decisions for themselves. And so then you may want to let go of a little bit of this and integrate some of the behavioral science into, democratize it and bring it into the interventions themselves as part of an integral part of scaling up your intervention at each point. One option. Simon, over to you.
Yeah, no, that's a really good point. I think the way we are approaching this work is that different methods contribute different things to help paint an overall picture of a topic. And so whilst there were a lot of benefits to using these vast, large global social media campaigns, we've also been conducting some survey research, which allows us to go in depth and really kind of ask more than just a few questions and really get inside the kind of the mechanisms and the kind of the behavioral science really beyond these kind of measures. So those can contribute to the picture overall. I mean, the good thing about doing campaigns and testing them on the platforms is kind of what we think of as ecological validity. So whereas these off-platform surveys, you can take the messages, you can take them and kind of explore them. The good thing about obviously doing it via these campaigns is that they on the platforms themselves is that obviously people are fighting with all the other information that's going on kind of on their screen, and so there's higher kind of validity there. So ideally, and we're also running some qualitative research. These are different tools for the same purpose in some ways.
Thank you.
Hey,
Mario?
Yeah, if I can come in, I think like maybe because the research that we conducted was very different, right? But I think I think sometimes generalizability is not the goal, right? I mean, once you get into a really specific context, what you want to have a relevant sample of the target population, right? And so what we did there is that we made sure that the panelists that we recruited, met some inclusion criteria, right? So then I think the conclusions that we can draw from, even though those were panelists, right? But to generalize to the very specific populations of employers of domestic workers in Hong Kong, like that research becomes much more relevant once we do this very to be very specific, and then it's not even the goal to generalize beyond that, right? So yeah, I think depending on the project, I mean, it's going to be a whole different question, yeah. And the tailoring, I mean, we've heard that also in Fern's presentation, right? I mean, that becomes, I think, I mean, their like practice and research is really moving into that direction. There's so much heterogeneity in intervention effects that basically not taken into consideration a really specific context, like we really quickly lose in precision of the interventions that we design when we try to go too broad, right?
Mm-hmm. No, that's an excellent point, right? And this is a big component of the discussion about like sample size. Like we see so many studies that are underpowered, and part of the reason is because we try to invite everybody to it. Whereas if we were to disregard heterogeneity in the broader sense and just focus on the target population that's most relevant to the issue that we're trying to achieve, then yeah, we benefit from increased power. Daniel.
I have a last comment on that. So, I mean, I think it always requires some balancing between rigor and adaptability. So, for example, for our skills profiling tool, like the core components, like the validity checks and the task frameworks, they stay consistent, but always like the language-specific needs to adapt locally. So, I think what something that we always need is to have this iterative learning process through, for example, local pilots. And in our case, one of our final goals tends to be empower local stakeholders with trainings and open resources. So these tools can evolve locally, but with the rigor, with the scientific rigor we always put behind.
Excellent.
Yeah, and just to add one, I think at UNAIDS, and I don't know how you do it in your organizations, but the communities that are affected by HIV are always at the center of our thing. And so I don't think we use as much discrete choice experiments because we often have them leading their own responses. So then you have the question of, do we need these external people who are going to come off and use sophisticated analytics applied to people, or can we just get communities to design their own interventions? It would be really interesting to see, compare at some point and to complement.
Excellent point. And I mean, just to build on that and to answer a couple of questions I'm trying to cherry pick from here is, you know, we talk about pre-testing, and a lot of things that we've discussed here is about like trying to measure it even before the intervention, trying to understand those behaviors. Do any of you have any good examples where the results were kind of surprising and it's kind of led to a big pivot or a big shift in what you were initially doing?
I don't know if it'll be big. Behavioral economics is
Doesn't need to be big.
about fiddling on the margins, isn't it?
Exactly.
But I mean, I've had some like small findings that had big results, where I put it in response to one of the questions where we had a demand creation for medical male circumcision, which reduces HIV among men by 60% protection. And we wanted to get the grown-up men, they call them mature, but they're like 20 and above. And from our discrete choice experiment, we found that one of the big reasons for not going for male circumcision is that they had to sit with the adolescent boys and they didn't all want to be together. So it meant that we just had to put a bench on the other side of the building, presto. But without some of the design understanding, you wouldn't find that. And I think that's the case with a lot of behavioral science, right? Is we're looking for those really easy wins that we could put the table left or we could put it right, and we don't think that it matters. But a lot of our methods are quite simple to explore, and you don't want to go into every iteration or detail, but some of them matter. And if we can get that right before we go to roll out and find out ex post, it's much more efficient spending a little bit more in advance.
Excellent. No, that's a great take. Thank you. We had one question on often interventions need to have impact with hard to reach groups. Do you have any advice on how to carry out behavioral science related methods reaching or / targeting these groups? I'm also going to invite Claire Hobden from the ILO to also join us to answer this question. Go ahead, Claire.
Sorry, do you mind repeating it? I didn't.
Oh, sorry. Do you have any advice on how to carry out, basically, how can you access or reach these specific groups, these hard to reach communities?
I mean, I think it's a really great question, and it touches on so many different sectors, and certainly it's inherent to the one that we work with all the time. We normally we try to go through, it's the International Labour Organization, so we have our social partners that are the domestic workers unions and organizations of employers of domestic workers. And so, you know, oftentimes we've had some experiments, for example, where or surveys with experimental components where we've been able to do a significant amount of outreach with the help of those partners, basically. And so then, you know, we have to do a little bit of extra work to reduce bias in the sample. But it's been, you know, a really critical way to reach a certain population. I think through social media channels and things like that, it's been a little bit tricky most of the time. But, and in fact, I think because we find that the nature of the behaviors that we're looking to change is complex, that in the end, actually, social media is not really the avenue that we want to take in any case. So we've put that a little bit on the back burner in terms of approaches. And then I would say the last thing, which is been key to the work that we did with Mario and in a lot of other countries where we want to reach employers of domestic workers. Actually, you know, the panels have been quite an interesting source. They work more or less depending on the country, but with the right exclusion and inclusion criteria, we've been able to get at least, you know, panels of employers of domestic workers. So those are the ways that we've normally succeeded in reaching our target group.
Excellent. Thank you so much.
Yeah, we respondent-driven sampling as well, but also we do have specific websites that do really work. If you want to reach men who have sex with men, then going on a male dating app is very successful, right? So some social media approaches work well.
Definitely. Exactly. And like as Simon said with ecological bullet. Yeah, go ahead, Simon. You go ahead.
Absolutely right. I mean, I think there is obviously a broad to reach, and of course social media is far from
is it just me or okay, sorry Simon. Daniel.
Yeah, I can jump really well. So yeah, I think in the way we implemented our script profiling tool, so we make this free of access, offline. We engage with local stakeholders. So for example, we ensure Wi-Fi hotspots. We organize community centers with tablet computer phones. We also reach through WhatsApp. The website is 0 rated. So on top of the original intervention of not having. Yeah, I think Simon is okay.
Yeah, I think okay. Carry on.
Sorry. Yeah. So so when joining with the local stakeholders, you can make even digital intervention like the ones we made, making accessible for people even without devices. Of course, the task is key for people in low literacy settings, but always getting to them. For example, I think one of the most useful things for us was the Wi-Fi hotspots. Thank you.
Great. Yeah, that's so that actually that feeds well into another question I wanted to raise from the audience here, which is essentially it was directed to you, Fred, but I'm going to ask everybody this: how do you balance out like ambition in the research question with feasibility, right? Like, how do you turn off the academic side to you of wanting to do a really elaborate study? You know, like Daniel talking about implementing Wi-Fi and things like. I mean, obviously that was absolutely necessary, but yeah, how do you choose that trade-off in the real world setting where we don't have the privilege or we need to act quickly? Yeah.
Did you say that was to me? I'm sorry.
The question was directed to you in the audience, but I'm opening it up to everybody. But
Yeah.
So please go ahead.
Who wants to answer? Go first.
Nope. Go ahead, Ben.
Well, it's a challenge because you want to make you want to get findings that can be published so that they can be shared globally. But we are in a global financial crisis, so we need to be tailoring as quickly and as focused as we can and be very realistic with absolutely what we need to do these things right. And I don't know what the future holds, but definitely quick and dirty is going to be one of a positive thing at this point because we need to make sure that communities are getting what they need in a really strong way. But always a bit of a pull and push.
Mario.
Yeah, I think that well, I was wondering, yeah, I mean, sometimes you don't even get to ask this question, right? I think it's really good to know what you would ideally do, but then, I mean, usually resource constraints will just like already like narrow down the set of tools or the kind of stuff you can imagine. But I think one really interesting approach that I think that could be taken more often is to, even when you run like the quick and dirty, as Fern said, kind of a study, then to think about how you can like really have an outcome that is meaningful and that already goes a little bit beyond cheap talk, right? So as much as possible, use some kind of consequential outcome. So is there extra time that the person needs to invest to make a choice that you would like to see more often, or is it like you can also do like financial incentives, right, in online experiments where then people like really need to make trade-offs. So I think using consequential choices, even in hypothetical scenarios, which can be more easily set up, I think that's a really important thing that, yeah, because otherwise the findings are not very robust.
And doing it right from the start can save you money in the longer term, right?
Exactly. Welcome back, Simon. So we're just talking about the balancing the trade-off between doing like elaborate, rigorous evaluations or studies or just measures versus doing quick and dirty. Any final points from you?
Yeah. So, I mean, we, these, for example, what I presented, these are field experiments really, where we did kind of evaluate them in real time, kind of opportunistically really, and then looked at them more in depth, the surveys and kind of qualitative data. But yes, I think some pre-testing so that you can kind of test these types of messages in kind of smaller kind of lab-based settings before then scaling it up, almost like kind of the analogy is kind of phase 2 and phase 3 trials really, with kind of kind of medical settings. I think that is beneficial.
Excellent. Thank you. Daniel, last words?
Yes. Last words. So yeah, I think the success is more about how we structure the tool from the beginning. So making it useful for super technical and clean implementation, but also for many different challenges. Because once it is implemented, so the extreme decreasing, like the cost decrease a lot. So we can use it for both structure and quickly dirty interventions. Because at the end, even if the findings are context specific, the idea is to make them credible for those specific contexts so policymakers can adapt it. And then with a fully developed tool, we can easily adapt it to different contexts. So it's, I think the main thing here is to, when you're developing, always think about the two scenarios and have it ready for clean super experiments and for the most difficult challenges, and things will be easier and cheaper at the end.
Excellent point. Cool. I think we're now out of time, unless anyone has any additional points they would like to share before we close out. Nope. Okay. Cool. Well, thank you so much, everyone, for attending and presenting these. This was excellent. I wish we had more time to really delve in. There was a bunch of questions that were very much more specific on each methodology. But yeah, we definitely need more of these advanced sessions for sure. Thank you so much to all of you for attending. And yeah, looking forward to speaking more about this soon. Thank you. Bye.
Thank you. Bye.